Friday. So on Fridays, I'm going to think about doing heart health updates. I think that might be something that can be helpful in terms of, giving you all information about what's new in terms of new heart-related medications or procedures. Hold on a minute.
It's also been a long week, so I'm going to treat myself to a glass of wine.
So before I get started, I want to talk about GLP-1s today. But before I get started, is anybody here on a GLP-1? Raise your hands. I certainly am, and it's been really, really helpful for me. One, to help with reducing appetite. But also, I decided to be on a GLP-1 because I got my lipoprotein A checked, and my lipoprotein A was elevated. So I don't know if you are familiar with lipoprotein A, but lipoprotein A is a marker of heart disease, and it is now recommended in the new sort of lipid guidelines that you have your LPA checked at least once in a lifetime. And your LPA is essentially a genetic marker, because for the most part it doesn't change over your lifetime. So unlike your LDL, which can fluctuate with diet, for the most part your LPA will be about the same, your LPA level. So they now recommend checking it. I would say probably don't check it until, your 40s, unless you have strong family history of heart disease, or if your LDL is considered in the range for familial hyperlipidemia, which is an LDL of 190 or greater. Or if a lot of folks in your family, let's say your parents or siblings, have had heart attacks, in their 30s or 40s, then you may want to consider checking your LPA a little bit younger. But for the most part, I'd probably wait until your 40s or so, because then it can be quite nerve-wracking, right? Like if your LPA is high, but you're, 20 years old, then that can be challenging, because it can be nerve-wracking and just anxiety-provoking, because there's not too much you can do at 20 unless your LDL is very high. So if your LDL is greater than 190, you're going to start a statin, at that age, and that LPA will be helpful, just kind of helping with more risk stratification in terms of looking at your risk for heart disease. But otherwise, if your LDL is normal, you're otherwise healthy, and you don't have strong family history, knowing your LPA at 20, it can be really anxiety provoking. And there's not much else you would do except for eating clean and, exercising. But I got my LPA checked. I gave a lecture about lipids, and then they had an opportunity to check, your LPA at that conference. It was called the National Medical Association, which is a conference for African American physicians, just to update one another and just continue to help, the community with understanding our specific risk factors for disease. So James, you're 40. Yeah, James, I would say it's probably a good time to check your LPA along with your lipid profile, just to kind of get a sense if you're now 40 like me. So I gave this lecture, and then they're like, oh, we're checking LPA. So I was like, okay, I'll go ahead and do it. My mom was at the conference. She's a physician, and my aunt is also a physician, and she was at the conference. And so we all got to check together. My mom's LPA is fine. My aunt's LPA is fine, but mine was twice the upper limit of a high level. So a high level of LPA is like 125 for that particular concentration, and mine was 250. So I want to have it rechecked just to make sure, but that was pretty high. Otherwise, I don't have any risk factors. No one in my family, thank God, has had heart attacks at a young age. Nobody in my family really has had a heart attack. My grandmother lived to be 107. My great aunt lived to be 110. My grandfather lived to be 90, and he drank like a sailor. And my father didn't take good care of himself. He smoked since he was in the military in the 1960s for probably 50 years, and he drank as well. And he still lived to be 75. Yeah, just past his 75th birthday. So for the most part, I do, thank God, have good genetics, but I do keep in mind, what that LPA tells me. But what I decided to do was go on a GLP-1. Because I was gaining lots of weight after 40. It was hard to keep, that perfect exercise schedule because I travel once a week. I fly every week to work because I take care of my daughter in North Carolina, and then I fly back to Kentucky to take care of folks in the hospital here. So because of that crazy schedule, I didn't really have, a lot of time to do my consistent exercise and all that. And, of course, my diet wasn't great because I was traveling a lot and stressed and, don't really cook as much. And here, there's not the best food in Kentucky anyway. So I just decided to try the GLP-1, and that helped a lot. I still do my best in terms of exercise. I certainly want to step that up more now that I'm more accustomed to this work schedule and everything. So I definitely plan to get back into running because it just makes me happier. It just helps with my mental health a lot just to exercise. So even if it's not helping me lose a lot of weight, it really helps just keep my mind steady. So that really helps me a lot. So, but in terms of the GLP-1, so I was looking into the data to see, what additional benefits can I get from being on a GLP-1 besides just the keeping my weight down so that I can keep my LDL lower to reduce my risk of heart disease. Because my LDL was it wasn't 100, maybe close to 100. And for the most part, you want your LDL to be less than 100 unless you've had a heart attack. Then you want your LDL to be less than 70. If you've had a bypass surgery or any other, and you've had diabetes and other risk factors like kidney disease, then, we may recommend an LDL of less than 55. But for me, I'm otherwise healthy. I just have this LPA. And so with the GLP-1, I'm going to recheck my lipids to see is my LDL much less than 100. And as long as it's less than 100, I'm maintaining my weight, then that helps a lot. So there's great data for Zepbound. Ozempic, I haven't looked too much into the data, but Zepbound I know just has great data as it relates to reducing cardiovascular disease risk factors, as well as just reducing cardiovascular disease itself. It's also a great adjunct to helping with people who have heart failure, especially the type of heart failure that's related to obesity, because there is a heart failure we call it HFpEF, or heart failure with preserved ejection fraction. So if your heart pumping function is normal, but it's just not pumping that well because it's stiff, that's related to obesity, and that's related to kidney disease as well. But a lot of these things are coupled with being obese. So and obesity just ages you, because you can get heart failure, you can get kidney disease, and that really ages you and can make it challenging to live a nice long life if you have obesity, which is a BMI over 30. So that's why I really preach GLP-1s. I talk about it all the time. I know that there are side effects, but, you have to weigh risks and benefits. Like, there are side effects of, maybe injection site side effects, but I haven't had any issues. GI, of course, nausea, that type of thing, but they give you Zofran. And so that helps with the nausea, and it hasn't been much of an issue, especially after a while, after taking it, long term. I've been taking it since November, and it's gotten better. And so, pancreatitis and gallbladder issues, hair loss, some things, related to, significant weight shifts. You can have hormonal changes, things like that, changes in mood. So you definitely want to continue to follow with your primary care, let them know what's going on while you're on a GLP-1 like Zepbound. But otherwise, what they recommend is just start low and go slow. So start at that low dose, go slow when you're up titrating it, and see what weight benefits you get. And if you get great weight benefits in terms of your weight loss with a lower dose, then you can just keep with that dose. And some people are talking about microdosing, but I don't know too much about the nuances in terms of microdosing and maintenance dosing. But, I don't get paid by the drug companies. I'm not going to lie. I put stock in Eli Lilly because Eli Lilly has Zepbound. They have an oral GLP-1. And they also are a pharmaceutical company for cancer therapies. And so because of those two things, they have a lot of new drugs coming, in the market. It fluctuates a lot. The stock has fluctuated a lot, but recently it's done really well. And I think long term, it's just a good bet to go with Eli Lilly. I'm not a financial advisor by any means, but I'm just telling you from an insider's view. I've been really pleased with this particular GLP-1 with its data. And so I know, I believe that company is probably going to do well just because I've seen the positive results on the other side. So, if you're thinking about stock, maybe considering that, that particular company, there's going to be a lot of shifts in the short term. But if you hold on to it, I think you'll be pleased with that. Because, as we all know, health is wealth. Again, I don't get paid by the pharmaceutical companies at all. I just get my salary, my paycheck, which I'm very thankful for, of course. But I don't get paid to push any medications. I never would tell you something because I'm getting paid by a pharmaceutical company to do it. I'll never tell you something because of anything that relates to advertisement or anything. I always keep it real. I always stand on business. That's something that you all can, trust me for, is that I stand on business regardless. So, that may preclude me from some leadership positions because typically they want people who are going to, people who are easily influenced and don't feel any kind of scruples as it relates to making recommendations to people that may not be what's best for them. But I'm a fourth generation African American physician. So that's how I was raised. That's how have always been taught. And my mom still practices medicine, and she's 78 years old, and that's how she practices. So we're always going to keep it 100. My mom, took care of patients with HIV. She took, all the way to COVID, and now, teaching people about hantavirus, and, Ebola and stuff like that. So she and I did a Heart Talk Tuesday, so definitely check that out. And it's also on YouTube as well. And you can get information from her. But I just want to let y'all know that you're always going to get the facts from me. You're not going to get anything that's there's no conflict of interest with me. Because, I'm going to always find a way to do what I need to do. But I don't need more. What I find value in is serving my purpose and doing that effectively and doing that with a moral code and being ethical. So that's me. But I'm going to post this. I'll post a little clip of this video, and I'm going to post some data about the GLP-1, about Zepbound, if y'all have more questions. But just, obesity, that's the biggest thing that we face. Obesity, like I said, ages people, and we're also dealing with an aging population, right? Because the baby boomers are getting older. And then we have we're seeing disease in 40-year-olds that we used to not see until you got to be 60, 70. But because of obesity, we're seeing people younger with heart failure, with heart attacks, kidney disease, and then having to go on dialysis and all those things. But obesity is really kind of that link that ties to a lot of those disorders, cancer. And so there's data to suggest that GLP-1s reduce the risk of cancer as well. So Eli Lilly is smart. They're like, let's invest the drug that's going to reduce, provide prevention, but we also are making drugs to help when people develop the disease. So they've got it on both ends. So, they're going to have a win-win regardless, because they're going to help with prevention. And a lot of people are going to use it, and then they're going to help on the back end too if you develop, cancer or something like that. So they're winning either way. So that's good for them. But for me, it's all about prevention. The best way to treat disease is prevention. There are very few cures. If you get an infection like, a cellulitis, you can take an antibiotic and that can go away. But if you develop heart failure, this is something you're going to live with for the rest of your life. Even if your heart function gets better on medications, we've got great heart failure medications. But even if your heart function gets better, this isn't something where you can just take a medicine and it's just gone. It just goes away. You don't have to see your doctor ever again for it. Like I said, a UTI or STD, I don't know what y'all be doing. That's okay. I'm not going to judge. But an STD or something, you can take, antibiotics, and that will take care of it. But if you develop heart failure, kidney disease, this is something you are living with for the rest of your life. So one question was, where is your practice located? So typically I'm mainly just on the in-hospital side. I'm a cardiologist, the only non-invasive cardiologist on the inpatient side of a hospital in Kentucky, in Owensboro. And that keeps me busy enough to where I don't have a big active clinic, but I do see patients who have cancer and heart disease, because that's my particular specialty, and that's something that I trained in. I got a Master's of Science. I've published many publications in this field. It's called cardio-oncology, and so that's what I mainly focus on. So someone said, what are your thoughts on taking folic acid? It just depends on what the indications are. That's more of a kind of an anemia related. If you have anemia related to low folic acid, that's something that your primary care can kind of give you more direction on that. But that's not necessarily something that's going to reduce. It'll help, because if you have anemia, that can certainly, and if you have heart failure, certainly you want to address that anemia. But regardless, you want to address your anemia because your blood cells bring oxygen to your tissue. So if you have anemia related to folic acid deficiency, then certainly you want to manage that. But in terms of folate in particular and the dosing, I don't, you'd have to talk with your primary care, but thank you for that question. And then Caroline said, is Lilly the company making Retrutude? Not, yeah, I probably can't spell it either. I believe you'll have to check that, though. You'll have to check that. If they're making that particular company. If you just ask, I use Gemini for everything. Their data has been good. I've vetted and looked at their sources, and their sources are good. They're using the American College of Cardiology, the American Heart Association. If you see those particular references when you're looking up anything on AI, then you know it's coming from the source. So in terms of that particular medication from Eli Lilly, I'm not 100% sure, but you can check with Gemini and see if that medication is also from them. But again, I'm not a financial advisor. I don't get any kickbacks because I recommended it. It's just something that I do, and so I don't see the reason why I can't tell you all what I'm doing. They said Lilly is now sponsoring the NBA basketball. Okay. I mean, that's a good sign, right? Like, if they're with the NBA, then, they likely have some kind of insider information, because